So thank you so much for agreeing to come on the podcast. Really excited to dive into conversation with you. As you know, I tend to start with this question, why does integrative medicine matter to you?
Well, thank you for having me on the show, Elizabeth, for a start. Well, it's also much why it matters to me. I mean, why does it matter to the patients?
Mm,
I think what I see integrative oncology as is a patient-focused approach to their management. And as I'm a mainstream oncologist as well, we often don't get a lot of time. We're not taught, and the emphasis is not about patient-focused care. I'm afraid to say it's about trying to get as many patients through the door and give them good drugs and cure as many as we can. So it matters because patients want it. They want to empower themselves with strategies which can reduce the side effects, to improve the chance of cure after radical treatments, or if they've got ongoing disease, improve the chance of getting a good outcome. Um, and it matters as a subject because, as I just said, patients are often not satisfied with the level of information about self-care strategies they get in mainstream oncology. More worrying, as you know, Elizabeth, because I presented this recently in a conference you were at, if you look at the type of information people are getting, it ranges from absolutely incorrect to very little at all, with probably less than 20% being correct about lifestyle and self-help strategies, which is actually quite worrying.
And you are unusual, aren't you? I mean, I absolutely love your book, How to Live, where you talk about lifestyle approaches that can really make a difference, not only to quality of life, but you even talk about survival, which is a big issue, about whether combining conventional lifestyle, functional, complementary approaches all into one model could actually help people live longer. So I'd love to know, how did you get into all of this?
Well, I'm glad you promoted the book there. Yeah, I mean, that was actually written about 4 years ago. I think it was sort of before. I mean, integrative oncology's been around for a while, but before I was familiar with it. I mean,
Mm,
you could almost call that book is based on not just cancer, but general lifestyle of how to, get the best out of life. How to live longer for stronger, stronger for longer, etc. Um, but I suppose, yeah, it does go into survivorship, and we used to call this sort of thing survivorship before. So there's lots of different
mm,
names for the same thing.
mm,
I mean, I suppose the original interest for me was, I went when I was a consultant oncologist. That was 28 years ago. The clinics were absolutely horrendous. I mean, there were 40 patients in a clinic, one single-handed. It's what you did those, and it was firefighting. So the first thing we did was think, well, let's try to shorten the consultations by preparing a lot of information for patients. So we sort of got into patient information, which seems routine now, but don't forget, 30 years ago, people weren't told, the basics about side effects and things. So we started doing a number of videos. We wrote handheld files, worked with cancer backup as it was back then. And then there's no point in producing them. We need to convince our colleagues that that was a good idea. So we did a double-blind randomized trial looking at an intervention video, actually. And it showed that if the more you tell people, actually, the better they feel, the less anxious they get, and the more satisfied they are with the treatment. So that was a sort of novel trial at the time, which not many people had done. And then we moved into looking at different endpoints for clinical studies, such as looking at patient preference as an endpoint for different types of hormonal therapies to see if we can figure out which ones patients prefer. And that was fairly novel at the time, and it's been used a lot since then, but I think we were one of the first to use that. And once we got into the sort of information and patient preference, I'm very keen on sport. So I know we all know that exercise and physical activity is fantastic, to prevent cancer and afterwards. So I was very keen to do a lot more studies looking at the benefits of exercise. We set up a level 4 qualification for personal trainers to try to get exercise into mainstream treatment, which I'm not sure if we 100% achieved, but I think it's becoming, it's quite common now for patients to be referred on to exercise programs. And then from there, we've said, well, diet is a big part of self-help strategies. And then we moved into diet, and then from diet into sort of nutraceuticals, because they were the sort of things you could use in double-blind randomized trials. So we're very much on the research side, and that's my interest. And then from the research, we then like to, go onto podcasts like yours, or write books, or write into lay journals to try to get the message we found from our research out into the public, and, to help as many people as possible, really.
Yeah, and I think there's a recent study in colon cancer, isn't there, showing that exercise during cancer treatments can make a difference to outcome. Can you say a bit about that? Because it might be new to our listeners and viewers, that level of evidence that's emerging now.
Yeah, I mean, I and many other people have written a lot of evidence reviews and systemic reviews on existing data, which has always been sort of retrospective analyses of
Mm.
cohorts. So, like the health professionals follow-up study, which follows, say, 50,000 people for 10 years. And it was quite clear that those who exercised did better. The original trial was also in colon from Australia, which looked back at a randomized trial and did a sub-analysis of people who exercised and looking at improved outcomes. So they were less likely to relapse. So we sort of knew the data was out there, but the purists would say, well, this was all sort of retrospective, even though they were prospective cohorts. It was looking back at it. So, I mean, I was convinced, and many other people were convinced already. And we set up an exercise executive committee in Macmillan. And from that data we had before the trial you're talking about, which I'll come to in a minute, we did manage to convince people to be able to be referred to the local gym and things after cancer. But this trial is actually the first sort of randomized trial, prospective, so grade A data, which actually showed that people who are put into a very good, fairly intensive exercise program, as opposed to standard of care, actually got a significant reduction in their cancer coming back to a greater extent than they got from the chemotherapy they were given. I'm not saying you do it instead of chemotherapy, but everyone raves about, the benefits of chemo. Now we have a randomized prospective trial showing that exercise gives even more benefit. So that hopefully will brush out all the cynical naysayers in this field off the pitch and say, look, you have now got to take exercise seriously after cancer.
Amazing that anyone would need convincing. But, I think, again, this kind of multimodality, this idea of how you combine a range of approaches is really important. I remember 10 years ago learning about exercise, some of the evidence, thinking I just don't understand how it works. And my understanding, but I want to hear from you, is almost like it's a super antioxidant that helps with reducing inflammation. But how do you think exercise works?
Well, we've written a number of papers on this. We wrote a paper in the British Journal of Sports Medicine, actually, explaining the probably about 100 different mechanisms exercise
Mm, mm.
can influence cancer formation and progression. I mean, if to put it in a nutshell, you could split them up into direct mechanisms and indirect mechanisms. So the indirect would be, if you're exercising in the morning, you're improving your circadian rhythm. If you're outside, you're getting a bit of vitamin D. There is an influence on weight. I disagree that people say it has no influence on weight. It is if you combine it with a diet. So reducing weight. And then the direct mechanisms, there are, direct biochemical mechanisms. Now, there's plenty of papers to show there's about 180 genetic things. The epigenetic expression of the genes changes after exercise. So the genes
Wow.
which are programmed to promote cancer tend to be suppressed, and the genes which suppress cancer tend to be promoted. So there's an epigenetic improvement. You mentioned oxidative stress. Now, if you exercise without a good diet, or you're a bit overweight, or you're old, or you're not used to exercising, and you exercise quite vigorously, you actually increase oxidative stress.
Wow.
And then the body, in reaction to that, then increases the antioxidant enzymes. Um, so in the longer term, as you say, your antioxidant enzymes are upregulated. So that's why people say exercise is an antioxidant. I don't like the term antioxidant. It's more about improving antioxidant pathways. Because
Mm.
after exercise, when free radicals have diminished, because we produce free radicals when we exercise, when they diminish, an efficient antioxidant pathway then switches itself off so you don't get excess antioxidant activity. We also know it improves insulin regulation, it reduces estrogen levels if you're postmenopausal and overweight, even before you get weight loss. You do get more inflammation initially, especially when you sort of get the muscle pains or you do you play football or rugby or something. But in the longer term, the inflammation gets better. And it also improves things like gut health. We know that if you jiggle your guts around, you increase motility. So, I mean, it's just, the list is endless. And if you want to read more about it, you just Google my name and the British Journal of Sports Medicine, and you'll get, the 52-page paper if you're that way inclined.
Yeah, fascinating. And it's great that you've summarized that for us. And also the nutrition element. I would love to come on to that because are you not the developer of pommy tea? Is that right?
Yeah, well, we've been doing a lot of nutritional studies over the years, initially sort of retrospective, looking at people who had good diets and they, you know, not surprisingly did better. But we wanted to do an intervention. And so 14 years ago, we looked at men with prostate cancer, and a lot of them were taking all sorts of supplements. And this is going back to your question, why is integrative oncology needed? I found it very upsetting that we'd be a study with like 30 people in it showing a marginal improvement, and then a subsequent study with 300 people in it showing no benefit, and yet everyone's just promoting the first one so they can make a quick
Mm.
buck out of it.
Mm.
So anyway, we wanted to sort of get a committee together and say, well, what is the evidence for certain foods? And well, we started with prostate because it's an easy population, lots of men with prostate, and a lot of them aren't on any interventions, it's just been watched. So we thought we've got a scientific committee. We got together and we came up with 4 foods which had the most benefit at the time from smaller studies, etc. And we wanted to get ingredients which work together so there's a synergy. And we did a double-blind randomized trial and it showed a marginal improvement. But that was 14 years ago. And since then, we've said, well, look, there are new foods which have shown activity against cancer. There's new food technologies which can actually fortify these foods. And there's more techniques in food safety and measurement of heavy metals and stuff like that. So more recently, we did another trial called the Your Phyto study, which looked at similar ingredients. So it had broccoli, green tea, turmeric, pomegranate, but cranberry and organic ginger and extracts of the same foods within the supplement. So that's quite unique because you either get whole food supplements or you get extracted chemicals.
Wow.
You very rarely see ones which combine the two. So what we see is try to get the best out of both. And we did another trial of 208 men with prostate cancer, and we randomized them. They all received that supplement. That's a long story why that wasn't randomized. It was probably because they wouldn't have gone into the trial without it. And they were randomized to a probiotic and prebiotic complex. But we measured the PSA progression before and after the intake of the Your Phyto. So it's a sort of combined phase 2 double-blind randomized trial, really. And we were actually quite staggered and very pleased with the results, which we presented this year in San Francisco.
It is amazing, the amount of research that you've been able to carry out, but also how influential the research is, in that it's starting to bring everything together into view that what we eat makes a real difference. And also the cleverness of what you have combined. I guess, are you recommending that people might take that all the time along with a healthy diet or take it at times where they can't take a healthy diet?
Yeah, I mean, but look, we always say, look, we use nutraceuticals in studies because
Mm.
we can measure the phytochemicals, we can standardize them. We know they are a very useful way of boosting the intake of these foods.
Mm.
Obviously, the ultimate aim is to show that these foods have a benefit and then people go out and eat them. It still remains unknown where you get the same benefit from those ingredients, but we'd like to think so. There have been studies which have just used dietary interventions. There were 2 in prostate cancer, and they were both negative, whereas ours are positive. So certainly within a trial setting, I don't think just diet alone probably gets the high enough phytochemicals to see an objective endpoint such as PSA. But that said, I'm hoping that data just encourages people in the longer term to improve their diet. And the other thing we looked at in the study was not only PSA progression, so in the combination of your phyto and the probiotic called Your Gut Plus, there was a 44% reduction in the rate of progression, which is actually very statistically significant. But not just that, this is what I love about integrative oncology trials. It improved grip strength, so men got stronger.
Mm.
And we know that in athletes, these sort of diets can help strength, but it's never been shown in older men to improve grip
Mm.
strength. We saw markers of inflammation getting smaller, lower. So these are objective measures. And not just that, we saw testosterone levels slightly going up, which was statistically significant. And we saw improvements in urinary symptoms and a slight improvement in erectile dysfunction. So, the add-on benefits, the secondary endpoints this is why we're so pleased about it. And this is what you see in lifestyle studies. You see people generally feeling better.
And
Whereas
getting
exercising
fitter.
drugs, I use them all the time, but generally the side effects are always worse on the
Yeah.
added things, aren't they? They feel more tired or get more hot
Yeah.
flushes. So we were really pleased about those endpoints. And it just shows that it's not just about the cancer, it's about your whole well-being.
Yeah, it is. And getting fitter like that is so empowering for the individual who's, had this difficult time of a cancer diagnosis and cancer treatments to know that actually they're now feeling better than they did before. They're taking more care. And, again, that trial really focuses back on gut health, doesn't it, as well? That, how healthy our gut is also how healthy we are. I just want to say one little thing. I love all of the ingredients, but I am amazed by the broccoli, the brassica family. And, they help in so many ways with gut health as a prebiotic, but also helping the liver and the liver enzymes, to detoxify. So it is just a way also if you're on a medication, you've had to be on maybe an anti-androgen, or for me, seeing women, an anti-estrogen. The brassica family can really assist so that you can reduce side effects. So it's just a win-win
Mm.
situation, really, because of that way that every part is doing its job with the body.
Yeah, I mean, that was originally why we included, because there were some studies of brassicas showing it reduced um, markers of prostate cancer progression pre-surgery. But I also had some patients who were taking like broccoli soup and things, and I was seeing anecdotally good response. So it's always nice to see it firsthand as well, isn't it?
Yeah, and I watched a program last night, the late Michael Mosley, who I love. I went onto Channel 4 and just watched some of the studies they're doing with anthocyanins, with blueberry powder, where they were able to show a dilatation of the coronary vessels about 20 minutes after taking a blueberry powder.
Mm.
And so this morning I was gathering blackberries.
Yeah.
These are hanging in the back of my garden. And, that color is one of the darkest, even darker than blueberries. But I guess what I love, and I think you're the same, is when you give knowledge to people, they get excited and then think, oh, I can do that. I can do that. It's almost like people need to understand why these things are important. And then that will motivate them.
If I showed you my back garden, there's a ladder going up against my hedge, and I've got blackberries. They're quite high up. So, yes, I totally agree. Blackberries are a free organic superfood, and we should all be chomping as many as
Honestly,
we can every day.
it's
But I
it's
agree
amazing.
with that. In my book, the first sort of 4 chapters are quite heavy, really. They go into the biochemistry of, what is inflammation, what is oxidative stress, how do cells make energy, things like the Krebs cycle. So a lot of people could be put off by that, but I totally agree with you, Elizabeth. If you really want to explain, and we try to do it in a way a lay person could understand, but if you really want to explain and then they understand it, they're more likely to then go out and make those changes. So I think it is important to have a bit of explanation.
I think it's super important. And I was aware as we were speaking earlier, maybe could you define oxidative stress? Because not everyone will know what that means.
Yeah, I mean, there's everyone gets mixed up between immunity, oxidative stress, antioxidants. Just in a nutshell, oxidative stress is factors which damage our DNA effectively. So,
Mm,
and as you know, many diseases, certainly cancer, the genes are already sitting in our DNA somewhere, and other genes are sort of next to them, locking them into place. So if you rearrange our DNA, the problem is you get these sort of snippets of genetic code, which has been dormant for thousands of years, suddenly being activated. And they then tell the cells to misbehave and to grow without regulation, etc. So anything which damages DNA, so it could be direct sunlight, it could be direct chemicals, it could be polycyclic hydrocarbons from meat. But also, the biggest component is free radicals. Now, free radicals are produced. Now, if you read chapter 4 of my book, they're produced just after the Krebs cycle, and oxidative phosphorylation. It's a byproduct of energy formation. That's
mm,
why exercising without eating blackberries or colourful foods isn't good. That's why cyclists always chop blackberries before they go cycling. So situations which produce more energy. So, in other words, if we're living with chronic inflammation, if you're overweight, if you're stressed and you have poor gut health, the body has to produce more energy. And that more
mm,
energy produces more free radicals. Now, most of the free radicals can be mopped up by antioxidant enzymes. But if you haven't got, particularly if you've got, say, a mineral deficiency or aren't eating enough phytochemicals which help the production of antioxidant enzymes, you've then got the balance is that there's more free radicals and less antioxidant enzymes, and that means your DNA is constantly under attack. So, but if you have the opposite, better gut health, you're not overweight, you exercise regularly, not too excessively, and you eat lots of phytochemicals and have lots of healthy minerals, then the balance is that your oxidative pathways are controlling your free radicals. So that's what oxidative balance is in a
mm,
nutshell. And it's different from immunity. Immunity is, this is inside the cell, and
mm,
immunity is outside the cell. So
mm.
immunity is like what's attacking the cells, like viruses and bacteria, yeast and things.
And we might just move on to immunity and the work you did with COVID, because I think, if I'm right, one of the components, citrus, that, like learning that again, the orange or the lemon, the actual rind seems to be very stimulating to the body. I add lemon rind. The Italians knew this, but I add lemon rind or orange rind to my food, to my sauces, to everything. But that is one of the components, isn't it, of what you found then was useful as an antiviral agent.
Yeah, I'm glad you I'm glad you mentioned that the Italian. Yeah, I mean, a lot of this isn't new, is it? I mean, it's been around for
Mm.
centuries. We just
Yeah.
ignored half. Yeah. So during COVID, we had to stop all our cancer studies. We had to do some ridiculous malaria national study, which we took part in. That was, but I did manage. I did think, well, if we still want to do research, I personally wanted to find out how to protect myself and my patients from
Mhm.
COVID. So we said, well, let's do a COVID study. There's lots of patients, and we can't do any other research. So we look back at the literature, and there's actually a lot of literature about which foods have antiviral properties from the previous. COVID wasn't the first viral epidemic. The SARS, we had lots of things, and we narrowed it. I mean, the trouble is it's thousands, but we narrowed it down to about 4 or 5 which had the most evidence. And as you said, citrus bioflavones, resveratrol, epigenin, which you get in chamomile, and did I mention resveratrol? But these
Yeah.
all seem to have quite interesting effects as antiviral, but they also, being foods, they're also good for gut health and all sorts of other things, help sleep. So we put together a complex called, which we then became called Phyto V, I think. Yeah.
Yes. Right.
Um, which had all those complex super concentrated as direct antiviral, but also they act as prebiotic. And it was very obvious from the literature in the early days that people with poorer gut health did worse. I mean, it was
Mm.
not
Yeah.
mentioned by anyone on TV, I can tell, but
Yeah.
everyone in the know, yourself almost certainly,
Yes. Just to
it
say, I
was
had a
obvious.
video taken down because it wasn't in the public interest, because I was talking about what you could do yourself to support your immune system. And gut health was one of the key.
I mean, look, we can't fight every battle, but I think my blood pressure every time I turned on, actually tell. The other thing we noticed that people with poor vitamin D, I mean, it was blatantly obvious
It was
because
so
ethnic
obvious.
minorities it was blatantly obvious that low vitamin D, poor gut health, lack of exercise, obesity, and all this is coming out now. It's all being published, and we're all
Yeah.
supposed to stand there going, "Oh, really? That's a surprise." No, and it was, as you say, they were actually told the opposite. I remember in May 2000, I think it was 2019, we were actually told not to take vitamin D.
Mm,
I mean, it's not as if they say, well, there might be something in it. It's probably a good idea to keep your vitamin B topped up, which would have been sensible. And then 3 months later, they're telling GPs to prescribe vitamin D. I mean, that 3 months they would have wasted. I mean, people would have died, I think, or got certainly more severe COVID because not taking that seriously.
I
So anyway,
agree.
we knew all that. So we combined Phyto V with Your Gut Plus, which contained lactobacillus plus vitamin D.
Mm,
That Your Gut Plus, then we went on to use in our prostate study because that's how we first developed it. We found to be successful.
mm.
And again, absolutely staggered. People who came from all over the country with horrible long COVID and some early cases as well, about 50-50. And there was a highly statistically significant, I can never say that word, statistically significant reduction in fatigue, inflammation, in acute stage, pyrexia, time in hospital. And now that combination is used around the world in COVID clinics and things. But as you say, those ingredients are available. You can have chamomile tea, you can add citrus bioflavones to it, you can have your resveratrol, probably not good idea to have too much red wine, but you can get it in other things.
And I do think that I'm a great believer in joy as an immune booster. So, I take joy creating meals that, have a range of colors, have a range of polyphenols, not because I have to, but because it's wonderful, like the Mediterranean diet is. It's the reason for its success. But I think the cleverness of some of what you've done is to really pinpoint some of the key elements like vitamin D and gut health, like those elements in chamomile and citrus and I can't say that word either, but from the skins of the grapes. But I think that what's important is to realize we need different things at different times. If you can get a supplement that makes a difference for someone, say in post-viral illness, and I've worked over many years with post-viral illness, and I think that what post-viral fatigue, what really kind of helped us in COVID-19 was understanding inflammation, understanding gut health, understanding how that predisposed us, and that actually identifying that a lot of us may have looked okay on the outside, but weren't very well. I've been managing my metabolic health with fasting, with a change in my diet, with a whole host of things. There's nothing like having to do it yourself that really activates you. And for example, I have used this product, which is a 5-day fasting pack. So I'm a great believer in just lots of tools in your toolbox means that you can get people feeling better. And then, of course, they start to change their life as I have.
Yeah. I love the way you said lots of different tools, because one
Mm.
thing I like about clinical studies, you have to follow people very accurately. You have to record their symptoms. You have to measure their blood tests. And there isn't a one fit all. I mean, we can get
Mm.
some people. Most people got significantly better. That's why it's called statistically
Mm.
significant. But not everybody. There were some people who did absolutely everything and they were still devastated. And I think,
Mhm.
it's identifying that group which is resistant to all the things we're talking about. And that's a group we need to investigate further. And maybe there are other ways we can look at them, and maybe diet and lifestyle can't help them. Maybe they will, but for the majority. But it's about trying different things as well. Fasting works for some people, not for others, etc.
Absolutely. And also sometimes emotional and mental health needs time to unpack trauma that, continues a stress response with dysregulated cortisol, all of these things. That's why, again, I really do believe in personalized medicine. I'm troubled that not everyone can afford it. I'm
Mm.
sometimes horrified by the way people aren't given good information. Some of my patients are actively told, don't bother about diet, don't bother about exercise. It's still happening,
Yeah.
even now, after I've been in medicine nearly 40 years. And I think, wow, guys, come on, we need to get our act together here.
You are entirely right, Elizabeth. I mean, and it's, as you know, I work 2 days a week in UCLH's Integrative Oncology now. And so I see a lot of patients coming from lots of different oncologists, whereas before, or my other three, I just see my colleagues and, I can influence them and we can influence each other and learn off each other's. But it's just, I mean, it's just devastating. There was a patient the other day told not to eat kimchi during chemotherapy because there's lactobacillus in kimchi. And she'd actually been admitted 3 times with neutropenic sepsis. I was saying, well, just on an N of 1 yourself,
Yes.
you've been told not to eat any foods which improve gut health, and you've been admitted 3 times. So I'm going to tell you to go out and buy some kimchi, and actually, in her case, take some lactobacillus probiotics to get herself back, up a bit. And I had to, write to the oncologist with the evidence review we've just recently, what is not really, is I wrote a review for a website called keephealthy.com where I was so annoyed about this. I then wrote a post summarizing the data to show that gut health reduces the risk of neutropenic sepsis during chemotherapy. So, we are trying, and yourself and I are, every time we come across this, we write back to the oncologist, we write back to the chemotherapy nurses saying, no, sorry, you were given the wrong information to these patients. And as a case of the wrong information, you're risking them not to do as well on chemo and get more side effects. And, hopefully the more you write and as every day passes, you'll convince more and more and more people. But it'd be nice to do that in a sort of national strategy rather than one patient at a time.
And that's why you're such a powerful influence in this field of change, is just that you're highly respected as an oncologist, now as an integrative oncologist. Those letters coming from you can be very meaningful. I've already told the listeners about my story of running an integrative cancer care service, coming into a hospital ward where someone had a Yo Valley yogurt at the end of their bed and had been told this is very dangerous while the chemo was running in. Now, that was quite a few years ago. And even
Yeah.
then, I kind of said, look, I think a yogurt will be a really good idea. And weirdly, because I was an NHS consultant, they said, all right, we'll give her the yogurt then. So,
Yeah.
and that was before the data. I mean, we had a bit of data that did actually show that occasionally high doses of unusual probiotics could cause a problem in the immunosuppressed, but that was very extreme. The majority
Yeah.
was safe, but we've got more research now. And I think that, people are frightened, aren't they? Healthcare professionals get frightened. They don't want to give the wrong advice. So what they tend to do is give no advice or the opposite. So you could be very powerful in that field of communication.
I hope so. Yeah, I think having a foot in both camps does help, as you say, but it does show a bit of naivety amongst oncology. I mean, even the thing about, kimchi or yogurts, I mean, there are trillions of bacteria in our guts. Do they
Yeah.
really think that, not eating healthy bacteria is going to help? I mean, I don't even know where they get the background. worry from. I mean, it's
Right.
quite clear that if we have more healthy bacteria in our gut, we're going to do better. I mean, and if you show me these trials of small bowel increased activity due to
Yeah.
neutropenia, I mean, I've not actually read any. I mean, I can't find any. There's lots of people talking about it, but I haven't come across a single case of someone who's neutropenic. What I do say, though, if you are going to take probiotics during chemotherapy, I would tend to go for the sort of more safer varieties. So I quite like,
Yes.
the lactobacillus you're going to get in yogurt and you're going to get in kimchi and sauerkraut. And it's certainly of that bunch is the safest. I do say to people, perhaps avoid these very complex probiotic mixes, which have got hundreds of different varieties. And I would just stick to the lactobacillus, to be perfectly honest, until we've got more randomized trials.
And sometimes, because the person doesn't want to be caught in the crossfire, I actually say, don't worry, let's just look at your diet. Let's look at a healthy range of foods rather than any supplements at that time. Because I know that sometimes pharmacists will tell patients to stop everything.
Mm.
As you know, I've been prescribing mistletoe for 30 years. And again, the research is improving all the time to show that it can stimulate those natural killer cells that chemo and radiotherapy can depress. It's even being shown now that those new immune checkpoint inhibitors, they actually can be enhanced. And I think, am I right with your University College London Integrative Oncology post that you might be overseeing mistletoe as well, Rob, or is that someone
Yeah,
else
I
in it?
mean, look, mistletoe is a healthy berry. I'm sure. I don't think you can eat it raw, mind you. Just
Yeah, it's poisonous if you don't eat
yeah,
it, everyone.
better just clarify that point. I don't prescribe mistletoe, but there's two colleagues who do. So I think there's I do other things. I mean, we all like to do different things, and so I don't
Yes.
do acupuncture. I refer on. If someone wants mistletoe, I refer on to two of my colleagues. They don't actually get it part of the NHS. They get the consultation as part of the NHS, but they have to pay for the prescription. Yeah. So, but not just that. I mean, whenever a trial is published, you know, it's usually in favor of these sort of foods. Like recently, eating lots of pulses, beans, turmeric, and things like that showed it reduced the side effect of radiation damage. So, up until now,
Mhm.
people have been told to avoid these. So, as you say, as more and more research emerges, the benefits of these natural products are coming out.
Yes, and I learnt that ginger releases gingerol, which is lovely for cleaning blood vessels. But also, I learnt more recently that the healthy bacteria absolutely love ginger. So now you've got a secondary reason why it might be health enhancing. Not that I've just had a lovely noodle broth with lots of chunks of ginger because I love it. And I think that's the other thing I've said is just getting used to foods, getting confident with foods that you then can love.
Yes, it's a natural emetic, it's a prebiotic, it has antiviral. And one good thing about ginger, and this is why we included it into the Your Phyto supplement, it
Yes.
works a bit like pepperin. It improves
Mm.
the absorption of other phytochemicals within other foods, yet it's got very
Interesting.
few drug interactions. So it's like an all-win situation. It improves gut health, it's antiemetic,
Right.
and it increases absorption of everything else healthy when you eat it.
I make my own granola, which is kind of low carb, no carb basically, but I add ginger and chocolate and cinnamon. And so
Hmm.
again, and then I have berries and I have high protein yogurt. So it's all kind of without sugar. And
Yeah.
I think it's great fun to put these things together. We're coming to the end, but I want to ask you another question if that's all right. What would you love to see emerging now in the next few years? You've put a lot of energy, your research is amazing, your book is fantastic. Those products I think are superb and I recommend them to people all the time. But what would you love to see happen now in the next couple of years?
I'd like to see more research. like
Mhm.
the bowel study, you know, which because that is that's the thing which is going to change policy. I'd like to, you know, try to get more of an integrative approach to mainstream oncology. So, for example, you know, if you've got someone with breast cancer and they're given hormones, chemo, biologicals, radiotherapy, surgery to improve outcomes, why aren't they then given a consultation to show that, you know, overnight fasting, vitamin D,
Mm,
reducing your weight, exercise? We're now knowing that these are actually on a par in terms of
mm,
improving outcomes. I'd like to see those consultations become routine. And on a national level, you know, I suppose we could do this. We could all get together and go to NICE and say we want to do an integrative NICE pathway, roll that out to clinics so that this misinformation is replaced with information which is correct. But it does involve more research. You know, it does involve more prospective randomized trials, and I'm keen to do more. I've worked in one of the breast consultants in UCLH is very keen to look at the Your Phyto supplement and give that in a randomized fashion to women suffering from menopausal symptoms.
mm.
Because there's so many people say, oh, you should take this, you should take that without the data. But if we've got the data, then women would be empowered to either buy it themselves or hopefully get on the formulary, but that's a long way off. But yeah, more research is the bottom line to your question.
Yeah, I love that. I love the nice guidance. My husband, who is a prof in general practice, reviewed the nice guidance and it mentioned lifestyle in almost every guidance. And yet, still, we don't recommend the lifestyle element. So, as you know, we run a master's program in integrative healthcare now. We're going into our seventh or eighth year because what we want to do is train healthcare professionals to be people like you, Rob, who've got the knowledge, they're studying the evidence, and they're able to speak to the lifestyle. And you know, because it's not talked about enough, I believe. It's changing, but slowly. So I think not only creating nice guidelines in integrative oncology, but also supporting young doctors to be more confident about how to put that lifestyle advice that is there in the nice guidance into practice.
Yeah,
What does it look like when you are resourcing someone within a consultation about lifestyle?
yeah, absolutely. It would empower the doctors and healthcare professionals, wouldn't it, if they've got that
Yeah.
evidence document behind them.
Yeah. Wow. Well, thank you so much and good luck with everything you're doing. Thank you for all the research and the writing you've done. And yeah, hope we might see you again on the podcast when you've done more research. Don't know how you find the time, but
Yeah.
thank you.
Well, it's a great pleasure to be on the show and congratulations yourself for all the work you're doing as well.
Thank you. Thank you very much.